Elevated blood pressure or hypertension is the most significant contributor to complications such as heart disease, stroke, peripheral vascular disease, and kidney failure. The consequences of these complications are devastating and deadly. It is important to remember that hypertension is the most significant preventable cause of cardiovascular and renal complications and premature death. It is the responsibility of the provider and members of the healthcare team to use a collaborative approach with proper blood pressure technique, education, understanding of the disease process, medication adherence, lifestyle changes, and the importance of data in hypertension population control. This is increasingly important with the newly released blood pressure guidelines. This series is designed to assist clinical teams to utilize a systematic approach to improve processes in their practices to ultimately improve blood pressure control. Welcome to Session 6. Each session builds on one another, so it may be beneficial to view them in order. In 2004, the Institute of Medicine, or IOM, published new rules for improving healthcare in the United States. The IOM stated, "We find levels of the healthcare systems need to improve their systems, processes, and outcomes of care to meet the needs of subpopulations." The new rules are 1. Care-based continuous relationships. 2. Care customized based on patient need and value. 3. Patient is the source of control. 4. Knowledge is shared and information flows freely. 5. Decision-making is evidence-based. 6. Safety is a system property. 7. Transparency is necessary. 8. Needs are anticipated. 9. Waste is continuously decreased. 10. Cooperation among clinicians is a priority. When designing a new process flow and identifying interventions, it is important to consider the IOM rules. The hypertension performance improvement activity can jumpstart action into implementing the rules. The first few sessions have demonstrated some steps that can help this along. Using performance improvement methodology and embedding the methodology into the team's culture is a great start. The discussion around baseline measurement and remeasurement is a movement towards transparency. If the team produces graphs that show process improvement, don't be afraid to post them in the waiting room. If the team is reluctant to go this far in the beginning, simply posting quality measure demonstrates the provider's team cares about quality. The process maps help identify points of waste and help the team redesign a new process to get rid or at least decrease waste. Redesigning a new process, ensuring proper technique for blood pressure measurement is a start at making blood pressure control evidence-based and safety of those patients are within the system. The concept around team-based care can help with healing relationships, care customization, knowledge sharing, and cooperation amongst clinicians. Team-based care can begin to make a start with patient accountability and anticipation of needs. Team-based care is extending the arm of the provider by sharing the patient care responsibilities with the team. This concept allows the provider more time in carrying out critical care decision-making and communication with the patient by taking away most, if not all, administrative functions that take away from the face-to-face exam and patient connection. The American Medical Association has a number of recommendations and tools to assist providers in moving toward team-based care restructuring. Team-based care is simply a sharing of responsibilities among the team, clinical and non-clinical, for the best patient outcomes. Functions include, but is not limited to, pre-visit, planning, and expanded intake activities including medication, reconciliation, updating HX, preventative care HX, and referrals, and collaborating on a set visit agenda. It may also include utilizing a scribe so a total attention can be focused on the patients during the provider visit. Depending on the size and resource of clinic, employing protocols and facilitating and making linkages to community resources can add added steps to your processes and utilizing the strengths of present staff. Employing the entire staff also sends the message of caring to the patient as well. This slide contains some core functions of a team. Some may require a bit of a learning curve, but most do not require a skill set of the doctor or the nurse. Here's an example of how a clinic used the strength of one individual to make a difference. There is a practice that could not improve their flu and pneumonia vaccines. Patients always had an excuse. One young and bubbly front office staff person started asking each person during flu season if they've gotten their flu vaccine yet. Each time a patient said no, she put a pouty face and said, One of my favorite patients like you got the flu last year and died from pneumonia. I would hate that to happen to you. I don't know if this is true, but she did it on her own, was not clinically trained, and managed to bump up the practice's number just by putting forth the effort to demonstrate some caring and concern. Studies have shown that 50% of patients understand instructions following a visit, 9% actively participate in decision-making, and 70% of patients with chronic conditions have poor adherence in taking medications. It isn't because we don't have the best medical care in the world. It is because there is so much information a patient needs to know about their disease process, medication benefits, risks, and side effects, and preventative care, as well as conflicting information patients see in our world of technology and social networking. The provider simply cannot provide all that is required for shared decision-making. Nothing says a true team by our country's military. Everybody has a duty and they look out for one another. Leadership sets the tone for a strong team and respect. The team works in a manner that listens to everyone's opinion and works together to solve problems. They move into position to take on another role if needed, and they have each other's back. No member of that team worries if they are clinical or non-clinical, or if they work the front office or in the back. They work together for one goal: to protect our country. Provider offices can learn a lesson from those men and women performing military duty. They have orders and standards to support them. It doesn't take a clinically trained person to explain why a patient needs to come into the clinic wearing loose clothing so a blood pressure cuff can go on the bare skin, or remind patients to not smoke or drink caffeine 30 minutes prior to the visit. Your team will find any team member can do many administrative functions that are now assigned to clinical staff. It is inhuman to expect providers and staff to remember everything. That's where checklists, protocols, and templates are a help at jogging memory. Educational handouts are good and kind, but they are just a paper. Although material is great reinforcement, it is no substitute for one-on-one education and teach back, which ensures patient understanding without making the patient feel dense. Protocols are very helpful as a guide for staff as to what to do in certain situations. If a member is triaged with blood pressure of, say, 240/120, will the staff know what to do? A protocol is a standard of care developed by the provider and supported by the team. The Million Hearts website has several protocols developed by different agencies for implementing evidence-based management of hypertension to use as guides. The website also has a template which makes it easy to develop one that the practice can call their own. You've heard them gather at stores like Target and Walmart. They are seen on the football field. It is what is known as the huddle. More and more corporations and medical practices are jumping on board to the idea of huddle because they are effective at increasing productivity by identifying those pesky common time wasters and taking care of them proactively. Huddles are 5 to 10 minute meetings that occur before patient care begins. Everybody stands. Nobody sits at a regular huddle time and place at least one in the morning. Huddles discuss patients coming in that day, expected lab work or other diagnostics, likely distractions, and other issues. They prepare for a special cause variation and tighten up the common cause variations that waste time discussed in a previous session. In short, the huddle calls the play-by-play for the day. Some practices huddle just in the morning before patient care. Some practices huddle before morning patients care and before afternoon patients care. What they do: identify urgent care slots, pinpoint possible needs of patient, lab, manual BP reading, proper cuff size, etc., expectations of the day, staff absences, and how to bridge the gap. Huddles reduce the need for sticky note info, email, texts that interfere with momentum of patient care. Think about how many minutes are wasted each day locating equipment, supplies, information, etc. A huddle can take those wasted minutes and turn them into productive, fewer minutes. A staff member might say, "Mr. X is coming in today, and he is known white coat syndrome high blood pressure patient. Can we get him in an exam room right away and start him on some relaxation techniques like deep breathing?" Think about all your common cause variation opportunities that can be dealt with before the patient visit. I am reminded about a patient not getting an MRI result that resulted in a delay of treatment for lung cancer. A huddle may have prevented this delay, as well as an upset patient and possible lawsuit. Choose routine, time, place. Alternate huddle leadership. It does not always have to be the provider or practice manager. Fitting team-based care into the interventions and redesign of controlling high blood pressure can be the first step in transforming the practice into a team-based culture. To summarize this session, process mapping is a graphic display of steps in a current process. A graphic display can help identify bottlenecks and non-value added steps in a process. A new redesign of workflow process can be done by process mapping. Team-based care is a great way of challenging support staff and assisting with patient care. Team huddles identify potential daily issues in routine and care. Next session will concentrate on choosing interventions, planning, testing, and studying how well they perform, and then putting them into practice. We look forward to the next session.